Pro Global presenta
Doctor, give me the news. Doctor, give me the news.
Hello, I'm Dr. Lynch,
And I am Dr. Doofenshmirtz.
and welcome to a new episode of the best medical program on television, The Doctors. In today's episode, we're going to talk about gastritis, which is a very common problem that many people suffer in Mexico and around the world.
Yes, that's right. And because of that, we have invited a specialist in the topic, Dr. Howard, and he's a gastroenterologist in our country to discuss about it.
But right before that, let's watch a sketch explaining a case involving this problem.
Two people found a chocolate at home. After arguing with who was gonna get it, one of them decided to just eat it. Then, after a while, he started feeling weird. Some odd symptoms similar to the symptoms that gastritis brings. Like his stomach hurt, he was feeling nauseous, like wanting to vomit. After a bit, he decided it was a good idea to go to the doctor. And once he got there, the doctor checked him and got to the conclusion that he had gastritis. So the doctor decided to give him some pills in order for him to start feeling better and to recover from those symptoms.
Welcome, Dr. Howard.
Thank you. I'm glad to be here.
So, doctor, could you tell us what is gastritis?
Sure. Gastritis is the erosion and irritation of the lining in the stomach.
Okay, that's right. And now we're going to talk about where and how is gastritis.
Yep. Look, many people know about gastritis, but they don't actually know what it is, like what it does.
So some of its symptoms are abdominal pain, nausea, vomiting, and sometimes there is a loss of appetite. There are many tests to tell if someone has gastritis, but the most effective way to find out if someone has it is through an endoscopy.
That's right. To treat this, your doctor will usually recommend a combination of antibiotics such as clarithromycin and amoxicillin or metronidazole.
I would suggest to use medicines besides the ones recommended by your doctors, such as omeprazole, lansoprazole, or something like rabeprazole.
Actually, once when I had gastritis, I asked my mother if she could give me something that we in the house could have in order to help me feel better. And that's what she told me, and that there were home remedies that wouldn't help.
Yeah, actually there are some remedies that help, but they don't really help you with the gastritis. What they do is they help you to feel better, like those symptoms don't bother you as much as they should.
Perfect. So far, let's bring gastritis its main cause and its symptoms. But what about the scientists who discovered what was actually happening inside our body?
That's right. I think it's time to mention the Australian scientists Neil Knox and Barry Marshall and the contributions to medicine.
It is important to include the fact that Marshall won a Nobel Prize for his findings on ulcers and a certain type of bacteria. Let's watch a video.
the past, gastritis and ulcers were considered a very serious disease that had no treatment, causing the patients who had it to suffer from pain in the stomach and other problems in the digestive tract. Neil Noakes was conscious of the severity of the problem, and he began to design a hypothesis that, if proven right, would benefit the world. He began experimenting, and suddenly, in the summer of the year 1984, an important discovery was made. Noakes extracted a bacteria from a rodent meal and began cultivating the sample until the bacteria was set for the experiment that was about to happen. Once ready, he put the bacteria in a recipient and passed it to his colleague Barry Marshall. He would soon become an award-winning human lab rat. Without hesitating, Marshall drank what was in the container and waited for 3 days for the result to appear. Effectively, he felt the symptoms of stomach ulcers and proved that Helicobacter pylori was the bacteria in charge of the disease. But he didn't stop there. He cured himself as well as with a medication that killed the bacteria. Years later, he became the winner of the Nobel Prize in Physiology and Medicine.
Wow, I will never sacrifice my health to make experiments.
Me neither, even if that makes me win a Nobel Prize. The good thing is that now we have the treatment for this disease.
But how can we possibly prevent or treat gastritis or stomach ulcers?
There are several ways to prevent or reduce the risk of developing gastritis, but the most effective is changing the patient's diet, making sure that he does not eat candy, chocolate, coffee, or cheese while having the disease.
Correct. Preparing diverse natural beverage could reduce the pain and kill the symptoms as well. These include the following: homemade lemon juice, which must be drunk after meal; potato juice, which must be drunk in the mornings without breakfast; and rice milk with a spoon of olive oil.
And this is just the beginning. Thanks to Marshall and his colleague, now we have an antibiotic medications that can kill the Helicobacter pylori bacteria, such as the clarithromycin, amoxicillin, metronidazole, and must be taken for 14 days.
Antacids also help reduce the acid production and promote healing. So, what we concluded from this? As we saw today, gastritis is an inflammation of the gastric mucosa that causes heartburn due to the gastric juices. The causes vary, although it is known that it is related to the presence of H. pylori bacteria in the digestive system, especially inside the stomach, where there is usually discomfort or other symptoms that depend on the body of each person.
The diagnosis of gastritis is not only clinic, but it is necessary to make more profound and invasive tests to be sure that the gastric mucosa is really irritated. The treatment includes antacids and other medicines that help to reduce the acid levels in the system. The diets are changed and often restrict people from consuming certain types of food and beverages.
We recommend you to always try to eat healthy and avoid eating or drinking dangerous or strange substances if we do not know anything about their ingredients or composition.
So, I think that's all for today. I hope you learned something more and that the information that was exposed for you.
Have a great day and see you next time.